Good morning, everyone. It is a pleasure to welcome you again to the fourth and final talk of Beyond Words, the seminar series where we explore the value that guide us at IIT. During 2025, four internationally recognized speakers shared how they interpret the values of courage, societal responsibility, integrity, and inclusion in their research fields. We explored the value of courage with Professor De Vivo from Harvard Medical School, who spoke about the connection between biology and emotion and about the courage needed to make certain choices. We discussed about the value of societal responsibility with Professor Southburn, looking at how even small individual changes in our daily habits can help us move toward a more sustainable future for our society. We then delve into the value of integrity with Professor Chatila from Sorbonne University, deepening our understanding of how to use technology in a conscious and ethical way so we can build a society based on a shared truth. Today, we close this series by talking about inclusion. Together with Professor Fung, we will explore the topic of neurodivergency and how the uniqueness of our minds can become strengths that enrich our community and workplace. And I now leave the floor to Raffaella Tonini, who will introduce the speaker and today's topic. Thank you.
So good morning, everyone. And thanks, Martina, for giving me the opportunity to say two words about this topic, which being a neuroscientist is particular of interest of what we do also, at IIT. So I personally think that for like an institution like IIT, embracing inclusion means understanding neurodiversity. As Martina said, neurodiversity refers to the natural variation in our brain that allow us to function and to behave in a unique manner. What is very important that is we need to, at this stage, we need to go through a paradigm shift. We need to go from a concept of, when we talk about neurodiversity, we need to move from a concept of disability to different abilities. And this actually, and we, as an institution, I really think that we need to implement action to engage neurodiversity within our workforce. So neurodiversity means variation, does not mean error. So our traits actually are not error, but are variation in the way we cope with the environment that is around us. And so I think this is really recognizing neurodiversity is really an opportunity for like institution like IIT. And I'm particularly actually happy that Professor Fung today accepted our invitation, because Professor Fung is really an expert in neurodiversity, and he has been devoted part of, I think, a lot of good of your career to this topic. So Professor Fung is associate professor at the Department of Psychiatry of Behavioral Science at Stanford University, and is also director of the Stanford Neurodiversity Project and director of the Neurodiversity Clinic. And of course, he acted as a principal investigator of his own lab. So I don't want to take any more time from your topic, and I leave you the stage. And thanks again for accepting the invitation. Thank you.
Thank you, Dr. Raffaella Tononi, for such a generous introduction, and Dr. Paolo, uh, where's Dr. Paolo Di Cusi, for you the invitation and really generously introducing me to IIT, and Martina Rocco also for organizing this seminar. So today I'm going to be focusing on talking about why neurodiversity is relevant in academia, and in many ways I think it is really important in science in general. I just really figured out that IIT technically is not an academic institution, but rather a research institution. So I probably should make it more relevant that this is really for the scientific community here. So we will talk about the strength-based model of neurodiversity. And one thing that really brought me to this work is really about my personal journey. My son got a diagnosis of autism about 18 years ago. And after that, I decided that if I'm going to do anything that helps people, may as well help my son as well. And I focused on autism initially, and then very quickly figure out that the medical model only does not really address the needs for people like him in terms of how they develop, because the medical model is only about deficits and it's not really about how to help person grow and become a successful and productive member of the society. So I'll tell you a little bit more about what neurodiversity is and why is it important for science and for academia. And I'll tell you a little bit more about the contrast between different models that are used in neurodiverse conditions. And then I'll further describe what a strength-based model of neurodiversity is and how we can apply this model in healthcare, in education, and in employment. And at the end of the day, we want to change minds, to change the mind of being only thinking about the medical model as the only model that we use, but rather a more holistic model that use both medical model and a neurodiversity informed approach. What is neurodiversity? Neurodiversity is really about accepting differences in brain function and behavior as part of normal variation of human population. When we talk about neurodiverse conditions, a lot of the time we think about autism, and some people would include ADHD or attention deficit hyperactivity disorder, and also other specific learning disorders like dyslexia and dyscalculia. It doesn't stop there. Other neurodevelopmental conditions, such as motor conditions, Tourette syndrome, neurogenetic disorders. Many of you are probably familiar with neurogenetic disorders that are being tested in like your neuroscience labs. And neurologic conditions such as epilepsy and psychiatric conditions like bipolar disorder, they are all under the umbrella of neurodiverse conditions. It's very common to see neurodiverse conditions. The prevalence of autism in the United States right now is 3.2%. And overall, most countries is about 1% or more. Dyslexia is much higher in prevalence, is about 13 to 14%. And then ADHD is somewhere in between 5 to 7%. So if you are to group all the neurodiverse conditions together, it will be at least 20% of the human population, which is substantial. When we are thinking about any trait, it's very much logical to think about the bell-shaped curve, and all of us know about the middle green area where the 68% of the people have the average trait. On the right-hand side, they have uh, above average trait, and on the left-hand side will be below average. So someone that has an IQ of 85 to 115 will be considered as average IQ. 130 maybe pretty smart. 145 and up will be considered to have genius level. Lower than 70, which is the red area, would be considered to have intellectual disability. It may be one way of thinking about how we uh, assess intelligence, but it is actually very limiting to only use IQ, because IQ only tells us about three things. It tells us about verbal ability, mathematical, logical ability, and visual spatial ability. It doesn't really tell us anything else. So Howard Gardner at Harvard University have really expanded our scope in understanding human intelligence to include further more than just what IQ tests can encompass. It will include musical ability, bodily kinesthetic abilities, athletic ability, naturalistic ability, interpersonal ability is the ability to relate with other people. Intrapersonal ability is the ability to understand self, and existential ability is the ability to understand your own existence, the universe's existence, etc. So everyone could have abilities in all of these domains, and so we can have a profile, a multiple intelligence profile. So to kind of illustrate how we conceptualize that and appreciate the multiple intelligence profile, we go to the genius of the genius, Albert Einstein. So what is his multiple intelligence profile looking like? Musical ability is almost above average. He played the violin. Visual spatial ability is at the genius level. Verbal linguistic, actually not so high. He didn't speak until 4 years old. Logical mathematical, he is pretty lonely in his own the island of genius. And naturalistic is average, intrapersonal, and interpersonal. Look at that. He actually uh, struggled quite a bit. And body kinesthetic, average. He at least ride a bicycle on time. So the genius of the genius, you would kind of maybe have some expectation that maybe this person must be good at everything, but that's not true. He actually have a very ununiform profile. There, he is very good in some aspects and actually struggled in some others. And that's how a lot of really uh, amazing people that has changed the world are looking like. So in addition to Einstein, there are many people, and some of them are Italian. Um, so you have Leonardo da Vinci, you have Michelangelo, um, and this um, this person is Giovanni uh, Alivi, a pianist and a composer, Italian, and as well as some other people that have changed the world. Bill Gates, he actually got disclosed his diagnosis of autism only like within the last year. And there are Nobel Prize winners. Uh, Here, like this is Barbara McClintock, who won Nobel Prize in medicine for genetics work that she did. And this person is very interesting. Freddie Jelinek is one of the first four patients that was described by Hans Asperger in 1944, and she ended up getting a Nobel Prize in literature. So even in the very beginning, when autism and Asperger's syndrome were described, there was an acknowledgement that there is a lot of strains in these very unusual children that seemingly they have differences in their social interaction uh, kind of tendencies, but they are many of them also have their very unique strains. So all of these people that's on this page, they either have a diagnosis of autism or they have the background that we suspect that they are probably on the autism spectrum. And one thing that is very much in common is that they are all very passionate about what they are doing. And because of that, they really change the world for the good. And in addition to people that have autistic traits, there are also people with ADHD traits. So here we have Alexander Bell, the inventor of the telephone, Thomas Edison, inventor of the light bulb, among all different inventions. We have some athletes here, Michael Phelps, who got more Olympic gold medals than anyone, and some entertainers here. And one thing that oftentimes they talk about when they talk about their ADHD is that without their ADHD, they are not going to be as successful as they are. And I'll explain a little bit more about why they would say that. And this page has people that have dyslexia. And when someone is dyslexic, they generally have challenges with reading, writing, and but some of these people here are actually really in the fields that need um, a lot of reading and writing. For example, this is Carol Greider, who won the Nobel Prize in medicine for discovering the enzyme telomerase. And here are two really prominent physicians in the United States, Stuart Udofsky and uh, Toby Cosgrove. So think about like these people are at the top of their field and they really need to read a lot. They need to write a lot as well, and that's really almost incompatible with dyslexia. But basically, they really change around and make their challenges their strengths. So neurodiversity can be a competitive advantage. And neurodiversity is really for everyone to be thinking about. And it is very important uh, to uh, acknowledge that this is important in science. And yesterday, actually, I was at the cathedral, so I took a picture, so I added it. But by the way, Genoa has some of the best buildings, interesting buildings I've ever seen. Um, so it's very important for us to think about neurodiversity because many of you have students who are students here and who are PIs with students. So there are many of you here. So there are neurodiverse students most likely already in your midst. And there are neurodiverse colleagues in our midst as well. Like in my institution, there are plenty of neurodivergent professors in our midst. And it's also important to acknowledge that the graduate students have um, some kind of mental health challenges as well. This is from about 3,000 people that are graduate students in the United States, and uh, about 39% of the doctoral students have been considered to be at risk for clinical depression, and 16% have severe depressive episode. And in terms of neurodivergent students, they tend to have more psychiatric co-occurring conditions such as depression. So how about in Italy? I cannot find exactly on a study that's related to graduate students, but from the studies that are in medical students, kind of close enough to graduate students that you may have. About 30% of medical students in Italy, this is from like almost 2,500 students that completed the survey, and they 30% say they have depressive symptoms. 14% had mild depression, 11% had moderate depression, about 5% had severe depression. Is really concerning. And when we are looking at undergraduate students, the university students getting their bachelor's degree, uh, 80% have experienced psychological distress. Is really an astounding number. And among them, one third have severe psychological distress. So I can only imagine that there is quite a bit of need to take care of the psychological distress for students in higher education in general, in Italy as well as in our country as well. And a lot of the time, the graduate students have the mental health um, challenges that are associated with like financial concerns, poor mentor relationships, any kind of programmatic bias. Um, so the worse these problems are, the more mental health challenges. And what's helpful for them to counter these mental health challenges would be having social support in general. And it's really wonderful to hear. I was talking with Raffaella yeah, last night that Italian community is very supportive. The families are very supportive, and that's a very good social support. And having support from the department is also a protective factor, and having the optimism about their career prospect is also going to be protective. I'm going to skip this one, but basically this is um, a commencement speech from a non-speaking individual called she she's her name is Elizabeth Bonker, and basically what I don't know why it's not okay. Anyways, but Elizabeth Bonker is non-speaking, and she can use the assistive technologies to help with communication. She graduated from college. Not only graduated, she graduated at the top of her class. And sometimes people may not know about neurodivergent people's abilities because they may jump into conclusion too quickly. And more in the United States, we have found that Elizabeth Bonker is not the only person like that. There are many of them that have been really shown to be able to have high intellect and be able to do a lot of really wonderful work. And one friend of mine, Hari Srinivasan, graduated from UC Berkeley, top of his class, and now he is a graduate student in neuroscience in Vanderbilt University. So basically, the point of adding that video is to tell you more about. It's not only about the people that you assume that they have the diagnosis, but they go to college, they speak, and so forth. Even those that don't speak, they also have a lot of potential. And a lot of the time, neurodiverse conditions are being described by the medical model. And the medical model is very appropriate when someone is injured and they need to regain their function. But when we talk about neurodiverse conditions, just like some of the people that I told you about, that are on the autism spectrum or ADHD or dyslexia, their inherent characteristic of their neurodiverse condition make them strong. So if you are to take it away from them, then that means you take away the genius abilities to change the world. So basically, we want to have other models that may be helpful. So social model of disability is one of them. Is basically describing that the disability is really shaped by the environment. So in this case, what you can see is that this curb cut is designed initially for people that have that are wheelchair users and they can mobilize themselves easily. And uh, and with this curb cut, the wheelchair user is no longer disabled. And the interesting thing is when you are including this feature in the environment, many other people also benefit. So you see the orange in the wheelchair, but also anything that's in orange in the picture, like this parent that's pushing her child in the stroller, this person that's pushing the dolly, and these people are pushing their bicycles, they all benefit. So sometimes when you're trying to figure out how to make the environment more neurodiversity friendly using these environmental changes, like a curb cut, you actually benefit everyone. And then the third model is strength-based model of neurodiversity. And I use this unicorn to show that it is really uh, describing uh, a strong creature like a unicorn that you think maybe there's some mysterious strengths in them, but if you are trying to understand their strengths, then you are going to be able to know what this is really about. And basically, when we are comparing the different models here, we can see that when we use the medical model, it's really about the deficits, and the social model is about the societal barriers causing the disability, and strength-based model is about positive attributes and strengths. It is also about protective factors and neuroplasticity. Maybe some of you are studying neuroplasticity, so it's basically part of it. And the medical model is about risk factors and pathology. And when we are talking about treatment for people with disability using a medical model, let's say in psychiatry, is about relieving symptoms by short-term psychotherapy or medications. And in strength-based model is about increasing well-being and growth by psychoeducational intervention. And this can be a preventative approach. And this is largely ignored in the medical model of disability. So basically, we need a mindset change. We need to think about more than just the medical model as the only way of thinking about the abilities of neurodivergent people. The strength-based model can also be illustrated by understanding the characteristics of autism as both challenges and strengths at the same time. So when someone is doing something over and over again and is not getting anywhere, then you may call it perseveration. But later on, if you figure out that the results are good, you're no longer going to call it perseveration. It's going to be persistence or perseverance. Challenges of autistic individual can be seeing big picture, but I would argue that it may not be a challenge. It's just a preference. They have a preference of seeing details first. They are drawn to details. And when you're a scientist and you really want that person to understand the details, then it is really a strength to have the tendency of being drawn to details. Seeing the big picture can only get used like kind of like maybe writing your grants, telling people that are laymen that why it is meaningful. But to actually do the studies, you need details. And autistic individuals tend to have fewer interests. When they are interested in something, they will just dive into the sea of knowledge of that particular topic and become an expert in it. Sometimes it may take a little bit more for them to understand other people's perspectives, but they are also very concrete and honest, which is a virtue. Social interactions may be different for autistic individuals, but they may be one of your most loyal friends. So one list of characteristics of autism that we have not changed, but it can be both strengths and challenges at the same time. So what can be more likely for us to figure out all those strengths is to really embrace their strengths, to really try to understand and be open-minded so that we can be staying on this side and allow more opportunities for autistic individuals to show their strengths. ADHD is somewhat similar in that it can be challenges and strengths at the same time. Impulsivity will come with rapid decision making. Hyperactivity will come with high energy. Difficulty focusing on tasks that they are not interested in will come with hyper focus on things that interest them. This tractability will come with creativity, and in fact, creativity of ADHD is one of the most understood traits of ADHD. And in addition to that, they are highly resilient, they multitask very well, they're big picture thinker, and they are cool in crisis. So when you look at this list of strains, it doesn't look like the characteristic of a disorder. It looks more like the characteristic of a CEO to me. So the strength-based model of neurodiversity actually have four components to it, and I probably will just briefly talk about it. And the first component is positive psychology. The second component is positive psychiatry. The third we already talked about is the Gardner's theory of multiple intelligence. And the fourth is triggering 7 vectors of development. And when we think about neurodiverse conditions, we want to call them conditions rather than disorder, and also acknowledge the challenges instead of deficits. And the reason for that is you see the characteristic that of ADHD and autism can be both strengths and challenges at the same time. And if you keep on calling these conditions disorder and all of those as deficits, you're going to be stuck on the challenges and what what is not going to be helpful for discovering their strengths. So when you make the terminology more neutral, then you're going to be more able to keep you to be more open-minded. And we also want to make the strength-based model apply to the entire spectrum of neurodiverse conditions. Um, a few words about positive psychology. That basically these three are the giants in positive psychology. Martin Seligman, Mihai Csikszentmihalyi, and Chris Peterson. Basically, they have this um, construct of values in action strains, and they are the 24 character strains that can be used to understand people's character strains, and could be something that's helpful to really be self-reflective and be knowing what strains that people, neurodivergent people, are using. And in the earlier slide, I actually talked about this already, so I'll skip this. And we also talk about the theory of multiple intelligence. The last component of the strength-based model of neurodiversity is triggering 7 vectors of development. So basically, these 7 factors are developmental tasks that all adolescents and young adults have to achieve in order to become a full adult. So they need to develop competence, manage their emotions, moving through autonomy toward interdependence, develop mature interpersonal relationships, establish their identity, developing their purpose and integrity. So when we are looking at these 7 vectors, we ask 3 questions. The first question is, how can we help neurodivergent people to achieve these developmental tasks? And the second question is, what about the people around them, like uh, their supervisors, their PIs, their coworkers? How can they help neurodivergent people to achieve these developmental tasks? And then the third question that we ask is about how about the mental health providers? Can they use more of a holistic approach and try to help neurodivergent people to develop better by using these 7 factors as a rubric? So using the strength-based model of neurodiversity, we basically form, so conceptually, we have the strength-based model. In order to implement the model in the real world, we have established the Stanford University project about 8 years ago. And basically, we have several objectives. The first objective is the most important, is about changing the culture. We want to change the culture so that we treasure the strengths of neurodivergent people, If we do it right, then we can empower them to really build their identity based on their strengths, and this can last for a lifetime. We have the ambition of wanting to attract talented neurodivergent students to come to Stanford to work and study, as well as going to our partnering organizations to work and study. And we want to train other people to work with the neurodivergent population and disseminate the model as widely as possible. Ultimately, we want to maximize the potential of neurodiversity, not only for neurodivergent people, but for everyone, because they have so much to bring to the table. On one hand, we are very person-centered. We want to look at the neurodivergent individual at the center. However, we also want to think about the ecosystem. So neurodivergent people, they always have their family and friends, and many of them have their mentors, their therapists. In the education setting, there are their teachers, coaches, classmates, roommates that can change their immediate environment to make it more neurodiversity friendly. And there are other people, the school officials and school communities that can also make the overall culture more neurodiversity friendly. In the employment setting, the supervisors, the job coaches, colleagues can immediately make their environment more neurodiversity friendly, and the executives and work community can also make the overall culture of the organization more neurodiversity friendly. And in the healthcare setting as well, there are various people that can really make things better by making the healthcare setting more neurodiversity friendly. There are various initiatives, including neurodiversity clinical initiative, education initiative, and employment initiative that we have implemented. And I'll describe some of the programs that we have run. And the first example is to first talk about what is neurodiversity informed care. Neurodiversity informed care helps neurodivergent people make their own choices and be in control of their lives. It offers a balanced perspective of both neurodivergent strengths and challenges. And the goal of this approach is to support neurodivergent people in living a healthy, happy, and meaningful lives in their own way, and not just the typical way. Because a lot of the time, providers tend to think that there is something that is neurotypical that's good for neurodivergent people, but that may or may not be the right thing for every single neurodivergent person. So we have a working group that have worked for about 9 months to really fine tune the principles behind neurodiversity informed healthcare. And after the working group have met, we actually did a study involving about 300 people in the community, and then do an expert consensus using the Delphi approach. And basically, at the end, we can come up with this acronym, RESPECT. So R is real life experiences valued alongside with clinical expertise. E, embrace the strengths and challenges of neurodivergent conditions. S, systems adapted to reduce barriers designed for neurotypicals. P, partnership with medicine, not exclusion from it. Oops, sorry. E, environment flexible and responsive to individual needs. C, comprehensive health focus, both physical and mental, for quality of life. And T, trust and respect are at the very heart of every decision. So basically, I'm going to just maybe skip the video, and basically some of the examples of neurodiversity informed healthcare can be related to sensory friendly and accessible environments, communication and interaction strategies, and also a new strength-based context-aware case conceptualization. In the education setting, we also have form a committee to define what neurodiversity informed education is. And what it is an educational model that supports a person to access, process, demonstrate, and experience holistic growth and learning in alignment with their strengths of their cognitive, motor, social, and emotional profile. And we also got an acronym for this, INSPIRE. INSPIRE is about inclusive strength-based learning. And this is really to help students to access their support and realize their potential and be presumed competent. N is neurodiversity affirming universal design. And this is to ensure the equitable access and flexibility in instruction, assessment, and engagement. And then S is systems that build educator capacity. This way, we can equip the educators with their training, resources, and mindsets needed to move beyond the traditional model toward more of a flexible, human-centered system. And then we have P, partnerships with the families and learners, so that we co-create educational practices with these stakeholders and include preferences, interests, their needs and strengths as part of the decision making. And then I is individualized, flexible pathways. This is basically to offer multiple means of learning and demonstrating mastery through varied strategies, assistive technologies, and alternative assessments. And then R is respect for the whole child or the whole student. We want to recognize that the student's strengths and challenges evolve across context and time, and design learning experiences that address their cognitive, social, emotional, and environmental dimensions of growth. And then finally, as explained, empowerment through educational transformation. We need to move away from the typical, more deficit-based didactic approach to really understand the individual needs of the students. So, so we have um, a summer camp that's called Stanford Neurodiversity Project Research Education and Advocacy Camp for High Schoolers, or SMP Reach. I don't know if the video will play, but we'll try. So this is a 2-week summer camp that we attract last year 136 students from all over the world, and each cohort has about 68 students, and they basically learn everything about neurodiversity. They learn about this universal design for learning, and they also do a neurodiversity advocacy project. And these are the topics that they learn, and they also learn about universal design, which are basically trying to provide multiple means of engagement, representation, action, and expression. And they do the design thinking project using a design thinking process. This is out from the design school at Stanford. It's a 5-step process of trying to first empathize, to understand the user's needs, and then define what problem they want to solve. And then the third step is to ideate, to get as many ideas as possible, and then create a prototype, and then test it. And basically, iteratively, we fine tune the process. So basically, with this process, the high school students, about half of them are neurodivergent, half of them are neurotypical. They collaborate and created many projects. And one of the projects is here.
Soon you'll meet him and everyone involved in bringing him to
for some
life.
reason
Here's a list of people who contributed to creating Sammy.
the, the sound is not playing. But anyways,
What is Sammy AI? Sammy AI is a
can you
website
hear?
with an AI chat box and a
Hmm.
build your own
Yeah.
story game.
So they
Our
only have two
AI is
weeks,
specifically
and
coded to
they
act
have
as a
about
friendly
10
agent
students
to
per group,
aid mental
and
distress,
they
offer
collaborated
advocacy,
together and
enforce
start from
action
scratch
support,
and
summarize and empathize on
develop
journal entries,
um, even
and
games
offer
and
local help.
websites that
This
are
game is a build
related to
your own
neurodiversity
story
advocacy.
game meant to teach neurodivergent and neurotypical individuals to learn how to communicate in many different situations they may encounter in their lives. An
Um,
example of one of our storylines is
I'm
how to
supposed
handling
to be
bullying at school.
going to about 4 minute mark to jump to, because it's a long 12-minute video, but it doesn't let me select the 4 minute mark. So I'm just going to tell you that there's like different components that they are building, and it is really from their lived experience as the core. The neurodivergent students really share their stories about what's important, and as a group, they use all of their talents in different ways. Some students are very good with coding, and some people are very good in arts, and some people are very good in organizing, like project management. And they basically all of them created kind of like a startup, and sometimes they would further their work even way beyond the camp, and they would enter competition, and some of them even win competitions in different places, and have uh, very significant impact to not only to themselves but to the community. And we did a study to understand how SMP Reach is helpful, and it can improve knowledge about autism and ADHD, but more importantly, it decreases stigma. All of what we are talking about when we talk about inclusion and talking about neurodiversity, the reason we are talking about it is because of stigma. If there's no stigma on neurodivergent conditions, we don't need to talk about it at all. So basically, by doing this camp, the students have decreased their stigma toward especially autism and ADHD. So I'm going to skip ahead so that we can cover the rest of it. Um, and the last piece of an example is to apply the strength-based model in the employment setting. And neurodiversity informed employment is about a strength-based inclusive approach to work and workplace design that recognizes neurological differences as natural variations in human cognition rather than deficits to be fixed. It aims to create equitable pathways for neurodivergent individuals to access, thrive in, and advance within meaningful employment through systemic, environmental, and relational supports. So again, we have an acronym, EMPOWER. So we want to provide equitable access for all employees. We want to match the person and the environment. And some people may be better at a particular kind of task and less so for other tasks. And if you are able to customize so that they are going to utilize their strengths more, then you can make that person more productive. Psychological safety is P, and O is opportunities for growth. Is really all about helping the person to grow in the workplace. And in all workplaces, we can have universal design to think about. So the curb cut effect that we saw earlier is basically universal design. E is evidence informed practice. more and more we have tools that we can provide, and some of the tools that our lab have developed can also be available for the community to use. And R is relationships and collaboration. It is not about only be like giving accommodations as employer. It's a two-way street. It's a collaboration of making the workplace more neurodiversity friendly. And a quick video here
University
for
project presents Empower to Employment,
this is one of
E2E,
our
an
curriculum.
online, self-paced curriculum to help employers, job coaches, family members, and others effectively support autistic and neurodivergent individuals in the workplace.
E2E was developed by the Stanford Neurodiversity Project in collaboration with neurodivergent individuals and the community who supports them. The curriculum covers high-yield topics such as building rapport with neurodivergent people, understanding the uniqueness of each employee through the strengths-based model, addressing the hidden curriculum in the workplace, and demystifying misconceptions and stigma.
E2E consists of 7 core modules and 5 supplementary modules, which feature videos, handouts, and quizzes to effectively improve knowledge, confidence, and self-efficacy in working with neurodivergent people. Spanish and Cantonese versions of E2E are available.
Please explore the E2E curriculum on our website and stay up to date on our developments by scanning the QR code, or reach out to us at Stanford Neurodiversity Project at stanford.edu.
We now also have Mandarin as well, a version, as well as a Korean version is coming out, and our collaborators in Brazil is also interested in translating to Portuguese. So these are the modules. About half of the modules are related to how to work with neurodivergent people in general. They can be in any kind of setting. And the other half are specifically for employment settings. And we also did a study to see if this is working, and we can see that the knowledge about autism is improved, but more importantly, the job coaches that have gone through the training they feel more confident and more self-efficacious in supporting autistic individuals. So it is really about changing mindset. And to finish up, I have too many acronyms maybe, but the last one is about how to change mindset. A is aspire. So A is about avoiding judgment. Don't jump to conclusion. S is about seeking to understand other people's perspectives, including neurodivergent people. There is a concept called double empathy problem. Basically, it's not only about neurodivergent people not understanding neurotypical people's position, it's also the other way around. That means the neurotypical person actually does not understand the neurodivergent person's perspective, which may be equally valuable, and especially in the scientific setting. The most innovative approach a lot of the time are the ones that are rejected first. So don't reject the strange ideas right away. And because they may be some of the most important ideas to be pursued. And then P is about pursue the improvement of neurodivergent lives. And R is relate through sharing personal experience. And finally, E is encourage hope and self-reflection. So if you have anything that you want to bring away, that these acronyms may help you with neurodiversity informed healthcare, education, employment, and mindset. So I'd like to close by inviting you to join special interest group for neurodiversity. You can scan the QR code. Let us know about your interests if you're interested in this topic. and introduce us to any group that is interested in learning more about neurodiversity and tell us how you want to be involved. By working together, we can make a difference to the neurodivergent community and beyond. And I'd like to thank many of my colleagues in the Stanford Neurodiversity Project and my lab and Gracie.
So thank you, Professor Fung. I remember that when we started our conversation, we were talking about neurodivergent people and also neurotypical people, and it was nice to see some clear example that you made on how, when we make small changes that we think are going to benefit maybe just a small community, in reality, you actually benefit a more larger audience. So thank you. Um, uh, are there any questions from the audience and also from remote? Of course, for people who are connected remotely, you can write your question in the chat and I'm just going to read it out loud.
Okay. Thank you very, very much for this really interesting talk. And it's a topic that we don't talk enough about. And thank you very much again for coming to Italy and talk to us about it. I have one special question that is about the comorbidity of autism type A and ADHD and how to deal with it in like like in our daily life and especially for like education and work. Thank you.
Mhm. So the first question, your question is like when co-occurring condition of autism itself and co-occurring condition of ADHD, or they are combined.
Yes, exactly. It's like when you have both of them, how
Yeah,
do you handle it?
yeah, it is actually very common to see ADHD as a co-occurring condition of autism, and to how to deal with it. I think first of all, one thing is to really understand the strengths first of each individual. It is going to be looking not cleanly as just like what I showed you, the strengths and challenges for autism only or ADHD only. And I have colleagues that have autism and ADHD who are successful psychiatrists, and they have a journey usually that's not very typical. That there are some people that understand them more, and some people that are um, not as understanding their needs, and so basically, if you are your question is about how to support them, is really to understand what their strengths, what they can um, really contribute to the group, and also understand their challenges at the same time. Everyone have their strengths and challenges, and I think it's not any different for people with autism and ADHD, but we may need to be more intentional to provide support. Um, the second question is,
No, it was this question.
yeah, okay.
And maybe like after a diagnose, like are there some resources that could be helpful?
Yeah, so after diagnosis, the um, the provider should be providing the resources. Uh, we also have a lot of resources in our Stanford Neurodiversity Project website. We have resources that's for people on the autism spectrum, for example, on our website. And every year we have a summit, a conference that's 3 days long, and every year we have just about like 36 hours of materials, and a lot of the talks are given by autistic individuals themselves, and they many of them are very successful people that have really gone through a tortuous journey a lot of the time, and they would explain how they deal with their challenges at different times, and eventually they have a successful outcome.
Thank you very much.
And those videos are freely available from our website. So right now there are like over 200 hours of materials.
Hi. Hi, over here. Hi, my name is Guilherme. I have a question. So from what I understood, and it's a brilliant way of putting the neurodivergent as the center of the model is individual based. But I was also wondering about public policies that can take place so that inclusion is actually happening. Like, for example, having a reserve of all the openings either at schools or at work. So a percentage of all the openings would be reserved for neurodivergent people. So would you comment a bit on public policies on this context?
That's a very important question, and in order to be most effective, we really need policy changes. And there are some examples. I just went to Brazil a couple months ago, and they actually very successfully. There are a autism self-advocate group that really push for the like a different way of evaluating students, because neurodivergent students oftentimes they are not very good at standardized testing, and especially like if it's a timed examination, and a lot of the time the standard accommodation is to give like maybe 50% more time, etc. As that's probably as much as that. And projects they would get more time to work on their projects. So that does not like need the policy changes and so forth. But the thing is, in order to be more able to be flexible, that this is actually a law for the neurodivergent people to have the rights to be tested in alternate ways. This is how they are successfully passing the law in Brazil. So not everyone that uh, like in the high school setting, for example, need to go through the same exact evaluation. If they can show another way of competency, then they also can pass their examination.
Thank you.
Thank you for the talk. Very interesting work and goals. I have two questions. The first one is regarding the first part of your seminar, regarding also the case of depression that are among the students. And I was wondering if there is a correlation of this case of depression with also maybe interpersonal and intrapersonal intelligence, maybe if they are correlated, or maybe they are also can be correlated also to the young age or the lack of experience to deal with problem, if there are some study about. And then I have another question regarding
Maybe one at a time. So otherwise I'll forget. I need to ask you again. So yeah, I cannot like juggle so many things. I'm neurodivergent too. So basically, what we know about let's say, autistic individuals. The autistic individuals have challenges with their social interaction a lot of the time, and many people that are successful in academia or in the workplace, they actually have to mask a lot. And what we know is that the masking, the level of masking or camouflaging, is directly proportional to the level of anxiety and the level of depression. So basically, that's an example of what you are asking about.
Okay, thank you. And regarding the second part about the neurodivergent people, sometimes people are not there is not diagnosis for some people, but maybe some people they can have some lack in the in some part of intelligence that are required in the workplace or in school, and they still struggle with some task or some relationship with others, even maybe they are not they are not a diagnosis. Maybe for them is even if even harder to understand that there is something that is not going on or something that they work about. Also, the colleague some can have some problem to deal with this for some diversity that maybe is not accomplished with a diagnosis. Also, this model can be applied maybe in a working place to maybe create an integrity among the co-workers, also to deal with the differences in that are not with a diagnosis. Is possible or?
So you're asking about like the like training the coworkers or
Yeah,
like.
training also understand maybe also some difference. Also, if there are maybe you say, okay, we have a divergence people that need to be integrated in the workplace, but maybe there are some people that have not a diagnosis. They have some struggling in the interpersonal, intrapersonal. And also to find the best fitting in the workplace, on the school, and maybe for them it's even more difficult because they don't have a diagnosis or also to find a purpose or goal. My question is, can be also a training for general people to understand this aspect to improve the social working life.
Yeah, so it is a two-way kind of approach that we'll need. So on one hand, we believe that the environment can be made more neurodiversity friendly so that neurodivergent people will be more effective in being understood. But on the other hand, we also train neurodivergent people about what we call the hidden curriculum. So those are the like social etiquettes that most people know about by being there. Nobody explicitly teach about the social etiquettes. Um, and for neurodivergent people, especially autistic individuals, they do need to be told about those rules, their social rules. So basically, our group also have developed materials, and we have done a study on uh, providing that support to autistic individuals in the workplace as well.
Okay, thank you.
Hi.
Mhm.
Thank you so much for your talk. It was very, very interesting, and I'm really grateful that nowadays there are these tools and programs for neurodivergent people. But I wanted to ask you more of like an advice, or if you have any tools also for the people that have been diagnosed lately in adulthood. And so they kind of have in them these masking and like coping mechanisms to live a more neurotypical life, but maybe they want to embrace their, neurodiversity and the spark that they have in their autistic features or neurodiversity features. If there are tools for also for these people or.
Mm. It is a little bit of um, more needing someone to be speaking with, like a therapist, to go through things because um, a lot of the late diagnosed people on the spectrum, for example, they uh, as you said, they mask a lot, but that carries a lot of burden. A lot of the time, at the end of the day, after masking all day, they kind of got really exhausted and um, but like not every single uh, like work environment is neurodiversity friendly enough and maybe not safe enough to disclose. So so it's helpful to have someone like a therapist to kind of like evaluate together and say like who actually will be good or safe to disclose to. And basically, if there are more allies that understand the neurodivergent person in any setting, it's going to be reducing the need for masking, and that will help with like reducing burnout, etc.
Thank you.
Mhm.
Hello, thank you very much for the very interesting presentation. So my question is regarding the modern life that is very busy and we can get easily distracted. We have many stimuli, no? How can a person distinguish between ADHD and maybe distractions from modern life? Maybe an adult that hasn't been diagnosed but has this characteristic. And also, does the ADHD can be like developed also in adulthood, or you are born with
Hmm.
this?
So that's answering your second question first. ADHD, by definition, is a neurodevelopmental condition that has to have uh, the the characteristics of autism to be shown earlier in life. So if someone has the ADHD characteristics uh, as an adult only, uh, usually for most providers, we are not supposed to provide that ADHD diagnosis. Um, and your first question, like, can you repeat your first question again?
It's regarding how to recognize,
Yeah.
how to distinguish if if it is ADHD or distraction comes from all the stimuli that we have in the modern
Yeah,
way of life.
I see what I mean. So it is like, for example, like um, this day and age with all the different gadgets, people really have a different way of attending to things, and it is not unusual to to feel like you have like ADHD characteristics. So the best way is to really find a provider to really sort it out and see if it is true or not. Um, uh, because like it is basically a change in the society that so the things that are happening around us um, sometimes can really make us feel like um, we need to be attending to like almost too many things, um, and it's not something that like 10 years ago, for example, that we need to be thinking about. So the most important thing is whether or not the um, there's a consequence. Like if because of the ADHD characteristics, if you do have some significant impact to your work or to your interaction with others, then that may need to be addressed. But whether or not that's through the ADHD diagnosis or not is really about the evaluation because there are other things that can be related to attention changes. Like people with depression, for example, can also have attention changes. So best to you to have the provider to guide.
So Fung, thank you so much, first of all, for what you just shared with us. I would like to ask something about the correlation between neurodiversity and neuroplasticity. And in particular, if is it possible in some way to use neuroplasticity mechanisms to help, let's say, neurodivergent people to amplify or mitigate or, let's say, module some their characteristics or talents in order to help them to live a better life or more complete life in society?
That's a very interesting question. And I think like neurodivergent people, especially for example with people on the autism spectrum, one of their strengths as well as their struggle is their cognitive flexibility differences. And because they are like really believing in something, when they believe in something, they cannot really change. They don't want to change the way that they are thinking. And that can be for the good if they are right about some kind of scientific pursuit. And nobody believe in the person, and because of the cognitive kind of inflexibility, they continue to pursue the subject and then actually maybe have a breakthrough in something. So it may be a good thing. But there are also some situations that that it may make things harder for them. So I think in one way it's I would have to say like it's really both strengths and challenges at the same time, right? So if your cognitive or the neuroplasticity change can help only with like the situations that are more difficult, then that may be a good thing. But what if you are also making the person less persistent in pursuing their science? Maybe they're not going to be as successful because they may not really pursue what they could have pursued a lot more in a persistent fashion. Does that answer your question?
Absolutely. Thank you so much.
Sure.
Thank you again for answering the audience questions. I think there are no more from the audience, no more from remote. Since we are talking about inclusion, I'm very happy to share that starting today, the Inclusive Language Guide is now available on IIT Internet, and you can also find a hard copy at the exit of the auditorium. And this guide is just a practical tool that helps us choose our words with care so that actually we can hear. Sorry. So that we can create a positive change in our organization and better our relationship. And I'm sorry, I'm going just to switch here. Before closing, I wanted to take a moment to thank all the PIs who contributed to the creation of this series: Atanasia Atanasiou, Marco De Vivo, Alessandro Asciutti, Paolo De Cuzzi, and Raffaella Tonini, because their support was essential actually to bringing prestigious speakers to IIT. I also would like to thank the scientific director who supported the initiative since the very beginning. And I also, of course, would like to thank all of you for your active participation, which we didn't expect actually, so that was very much appreciated. Of course, I want to thank also Fabrizio, our general director, that supported the initiative as our scientific director. And well, just for closing, before I let you go, with this series of seminar, we wanted to explore the values that guide us at IIT. starting from scientific topics and moving toward social issues that concern each of us and that we encounter in our everyday lives. The values guide our choices, help us understand what truly matters, and shape how we relate to each other. So let them be a constant reminder of what unites us and what we should strive for. I hope that with this series of seminars, we help you see that the true value of an organization doesn't come from the role we have, but from the people we are. Yeah. Yeah, sure.
Actually, I really like to thank you, Professor Fung, for being here today. And I'm sure that your talk will be inspirational for many, many discussions, because I could see, knowing the audience, okay, I know that your talk really trigger a lot of questions in our brain, and I'm sure they're going to be follow-up. So thanks again for coming, and even long trip for me here too. Thank you very much.
And as usual, before leaving, just don't forget to grab your sticker of the value of inclusion and also the voucher for get a free drink at the cafeteria today. Thank you again.